Comfortable there?
I'm very comfortable.
Okay. So, I'm going in her mouth. I'm staying on the cheek line and aiming. It's very tender to palpate, so just be very gentle. Okay? And relax.
Or feel like a fish.
Just relax. There you go. Open your mouth just a little. Open your mouth a little bit.
Oh.
Yeah, isn't this painful?
Yes.
That hurts.
painful.
Is that a 1?
Don't forget 2 is
Okay.
leave.
Is it familiar to you or unfamiliar?
I've never felt that a day in my life.
Okay. That's fine. That's good. So it's probably a latent trigger point. Okay. And
Latent trigger.
okay, open your mouth a little bit and move your jaw to the left.
Oh.
And relax. Okay. So remember your pterygoids do contralateral jaw excursion. Right? So that's what I was doing. Okay. Good. And then I'll do the same thing on the opposite side.
Bro, that's like, you know when a basketball hits you in the nose, you don't want to cry, but it like hurts?
That's exactly what it is. It's painful, isn't it?
Yeah.
Are you tearing up?
Yeah, it makes you, I don't even want to cry. It's
That's
just,
crazy.
it's like cheering up.
No, it's not what I meant.
Wipe is crazy.
Eli's next. How about that?
Okay. And try to move your jaw to the right. Okay, and relax. Okay, more painful on the right than the left, right?
Oh, yeah.
They were going to be painful, didn't reproduce her symptoms, but it was more painful on the right than the left. So muscular-wise, she has a lot of muscle dysfunction on the right side.
Would a latent trigger point also fall into like cluster signs?
No, because nobody believes in trigger points.
Better answer.
Yeah. So for example, the neck pain CPG has a disclaimer about dry needling does not have any effect for neck pain. Nowhere in the CPG does it ever mention muscle or trigger points, but yet they pulled in research that just doesn't make sense.
That makes
Right?
sense.
So all the CPGs to me are very biased to joints, special tests, test and measures. Very few of them pull in any muscle or muscle dysfunction.
And also why palpations like last.
Well, it confirms, right? Because if you provoke their symptoms, then everything else can be false positive. Okay? So that's the pterygoid palpation. Good?
Can we see on the
On the
model?
here?
Yeah.
Maybe.
Oh.
Nope.
Well,
There we go.
You said sorry.
don't ever let him borrow your toys, because this is how they're going to come back.
Don't let him touch your jaw.
Yeah, your jaw.
Heavy.
Okay. So mouth open. I'm coming in here. Right in this would be hard to show. Okay.
Need a
just
third
open
hand.
right
Let's
there
go up.
now. So I'm right in this corner right here, inside.
You're just pushing up into it?
Yep. I'm inside.
I don't like that.
You mind if the camera gets a look?
Right against.
Oh, so it's still like on the outside. It's just like way
Oh,
back.
that's perfect. Yeah.
He's back, but it's like outside the
Yeah. A little closer.
Outside, yeah.
area. Okay.
Towards the TMJ.
But so can we follow like the motors, get past them, and then just go up after? All right.
Yes. So here's the pterygoid plates. Remember those? Medial pterygoid plate, lateral pterygoid plate. So lateral pterygoid goes here. Medial pterygoid goes down to here.
Yeah. So you're still on the inside of the mold.
Yep. So I'm right inside here like this.
Yeah.
Okay? Make sense? This is the lateral pterygoid plate. Pterygoid muscles go like this. You don't touch on the corner.
Is that what you were showing me that you went really deep here that it bothered me?
Say hi, Nicole.
So the medial pterygoids is here. Medial pterygoids are here. Lateral pterygoids are going to be way up in the corner.
Way up.
Inside. Okay? Good? Okay, and then we did passive overpressure retrusion as part of our passive overpressure. It can also be a special test. So on your exam sheets, the TMJ exam, it's both places. Okay? But really the true special test for TMJ is the bite test, the unilateral bite test. And that'll help you sort out whether it's muscle or whatever. So for her, because it was positive for muscle, I'm probably going to go to treat her muscle first. Okay. So how are we gonna do that? I'm gonna do, so I'm gonna do some trigger point release. Okay. So when you're doing trigger point release, you're trying to find the most tender spot in the muscle. So I'm gonna palpate a little bit, and you tell me which one's the most tender. That one there?
Yeah, that one.
Okay.
Yep.
Okay. So I'm gonna put pressure on it, and so give me a number: 0 being no pain, 10 being the worst pain.
Like a 3.
Okay. So you don't want to go more than a 4, because if you push long enough and hard enough on any structure, you can hurt it. Okay. So then what I'm going to have her do is she's going to just slowly clench her teeth, slowly, and I only want the muscle fibers underneath my finger working. So just clench your teeth just a little bit. There you go. Hold it right there. 10 seconds. 9, 8, 7, 6, 5, 4, 2, 1, and relax. Okay. Keeping the same pressure, and I'm going to repeat that 5 to 7 times.
That's masseter.
That's masseter, and it's called pressure release. We don't use ischemic pressure because in the area of trigger points, it's already ischemic and hypoxic. So if we create deep ischemic pressure, we could actually aggravate the symptoms rather than treat them.
What do you mean by ischemic pressure?
Pushing blood off.
So pushing it so hard.
Oh, that it's stopping
Mm-hmm.
perfusion.
You're gonna stay
Okay,
on the
so
tender.
slowly. Yeah, I'm still staying in the same place. Clench your teeth together. Hold
So
it
it's
right
like-
there.
So
Perfect.
it's just like a medium pressure type.
Mhm. No more than 4 out of 10 pain.
Got it.
And relax. Okay. The other thing I could do is use reciprocal inhibition. I can ask her to try and open her mouth, and I'm going to resist it. Open your mouth and resist. Hold it. Hold it. So I'm using reciprocal inhibition now. I'm using the depressors to deactivate the elevators. And relax. Okay. Now we're going to palpate again. Worse, better, same.
A little better.
Okay. Right there, right?
Yep.
Right there. Okay, let's work on that one. So go ahead and just clench your teeth really lightly right there. Perfect. Okay. And relax. Clench again. Just talking about the chipmunks.
You heard that?
Yeah, I heard that.
What do you say?
And relax.
Like what are you talking about? The chipmunk?
And one more time. Right there. Perfect.
Like Theodore and
And basically saying that Nicole looks like a chipmunk right now. She was drinking
And relax.
thanks for the ration.
And try to open up.
Not funny anymore.
Perfect. And relax. Okay. I'm going to reassess. How's it now? That's better, isn't it?
Yeah.
Sorry, Dr. Only, how many times are you gonna do the reciprocal inhibition?
You can do it in between each set.
Both will assist, and you work with the patient to see which one works better.
Clench again.
Both work for the patient, and then you just see which one works
Yep.
better for the
Yep.
patient.
See which one I'm going
Like
to show her
reciprocal
to do at home.
Oh, okay.
And relax. Good. Okay. How you doing?
Good. I'm
Good?
tired.
Squeeze the cheeks.
It's a lot of work.
It's hard to concentrate on just,
Yeah.
right? It's a lot of work. It is a lot of work. Okay, that's under, yeah.
Oh, yeah.
Okay, let's do this one.
You do great, Nicole.
Did you hear what she said about activating the part of the muscle I wanted her to activate? That it was exhausting. It's hard to really tap into just contracting that part of a muscle. And relax.
Small movements. Muscle bellies are super tiny compared to what we're used to palpating.
And one more. Remember about the masseter. The masseter has very, very small tendons. Tendinal insertion is like millimeters. So there's lots of muscle belly to work with. And relax. Okay, let's reassess. How does that feel like now?
Better.
Much better, right?
Yeah.
Okay. So here's what you're gonna do. Okay, your tongue is gonna be on the roof of your mouth, behind your top teeth. Okay, right behind your top teeth like this. Okay, and then what I want you to do is slowly keep your tongue on the roof of your mouth behind your top teeth, and I'm gonna have you open your mouth slowly. and keep that tongue position. Tongue up, tongue up, tongue up. Okay.
That's hard.
And relax. And you
So-
do that 10 times. So
Doctor,
she is,
Are you resisting her?
I'm doing nothing.
You're just pressing.
Nope, just doing nothing. Just
Why-
watching.
why are you-
Just
oh,
watching.
you're watching.
Just
Okay.
watching, yep.
You just
And,
feel
and see if you can, nope,
No.
just see if you can get your tongue more of a point
Mm.
rather than all flat and like doing this, right? So what's the one muscle in the body that has an origin but doesn't have an insertion?
Assuming the tongue.
The tongue. And where should the tongue insertion be automatically? On the roof of your mouth, behind your top teeth. Okay, so the tongue acts like a sling to help support the mandible. So with Nicole, more than likely her tongue is not there usually. And her masseters are working overtime to hold up the jaw.
Wait, I'm confused.
So the tongue is like a sling.
Uh-huh,
It has to hold the mandible.
uh-huh.
Okay, the only way you can do it is if your tongue is in the resting position. Where's your tongue?
Oh, yeah.
On the floor of your mouth, probably, right?
I don't know, I have a weird,
She has a
like,
short tongue.
Right, so the tongue is either, so people
can't
who have
touch the roof of
TMJ
my mouth.
dysfunction, you can't get it all the way up to the top there. So that's gonna feed into some perpetual muscle issues because the tongue can't do its job, okay?
so, okay,
So your masseter and your
but what
temporalis
do you
have
mean
to
it's
work
working
overtime.
over, what do you mean it's working over?
Because the tongue, so the natural resting position of the jaw is the tongue behind your top teeth,
Okay,
your lips together, your teeth slightly apart.
okay.
So the tongue is actually helping suspend your mandible. If your tongue is not on the roof of your mouth, your
I
masseter
see.
and your temporalis have to work to keep it there,
So it's basically working double the work
double the work.
instead of
Right.
sharing.
And so since you have that dysfunction where your tongue doesn't think, you're gonna have perpetual muscle problems. So we'll be teaching you how to do a lot of pressure release on your own,
Okay.
because you'll be fighting against that. The biomechanical disadvantage, which is your tongue can't get to the roof of your mouth.
Now, if she has like, you know, like.
Did you
if-
stop?
Oh yeah.
No, keep going.
If someone has like problems because their like tongue isn't supporting their jaw,
Mm-hmm.
does that something that they get used to over time, or is it just like always a problem?
It's always gonna be a problem. Okay, so get the tip of your tongue right behind your top teeth. There you go, better. But on the roof of your mouth. Don't push on your teeth, just on the roof of your mouth. There you go. And, yeah, and close. So this is a Rockabato 9x6x6, okay? So that's in Dutton in detail. So the first, number one for the Rockabato for all your patients with TMJ dysfunction is the resting position of the jaw. Lips together, teeth slightly separated, your tongue is on the roof of your mouth, behind your top teeth. Number two is controlled mouth opening. And that's what she's doing now. Tongue on the roof of your mouth behind your top teeth, and she's only opening as far as she can by keeping her tongue in that position. So that's gonna help restore the rotation and translation bilaterally. It's hard, isn't it?
Mm-hmm.
You tired?
Mm-hmm.
So she's trying to open as much as she can with her tongue.
Controlled, yep. So I would sit her in front of a mirror, have her look in a mirror, and have her do the exercise.
Your tongue is on the ground.
Okay? And close.
Your tongue don't.
I don't see the S or the C abnormality with her, but is it normal like how when she's bringing her jaw back up, it kind of protrudes out and then comes back in?
Yeah, so she has this little judder, if you will. Okay, so she had an S deviation when we first looked at her. Okay? Yep. So now I want you to open as far as you can, but avoid that aberrant motion. Where you
Avoid
feel
it?
like it's gonna. No, that's too much. So you gotta stop before that. There, and close. There you go.
So you're stopping
That's all I got?
before?
That's all you got. Yep. Because every time she's feeding into the dysfunction. So I'm trying to get some muscle balance back without feeding into the dysfunction.
On the way back.
Oh yeah.
Yeah, on the way back.
So you see the aberrant motion on the way back.
I'm not gonna be able to eat anything.
Talk about eating. So no more chewing ice. No more chewing gum. No more chewing
bro.
straws. No more chewing the little stir sticks on your cocktails.
You're lying.
She doesn't drink, so it's fine.
That's good.
Allegedly.
Allegedly.
Hey.
But she could be having a Shirley Temple with a stir stick.
Hell yeah. Hell yeah.
Okay. So all those parafunctional habits, right?
The gums.
If you sleep on your side or on your back.
I sleep face down.
Okay, no, we're not sleeping face
Well,
down.
I just told her to get a
I just got a new pillow though. I got a new pillow.
So she can put it- So she's a prone sleeper.
Can't do anything.
Settle down. So if she's sleeping on her belly, what's happening to her jaw? What do you have to do in order to stay alive?
Have your head. Yeah.
Rotation, full rotation, pillow or whatever pushing and deviating the jaw for hours.
Huh?
Okay?
Sometimes I prop a pillow on
Same
my
thing,
forehead so I have room.
So roll on your side.
Which side?
Right side, if you will.
Okay.
Okay. So let's put the pillow off your shoulder.
Yeah,
Okay.
show us how you sleep.
Do you want me to show you how I sleep? So I actually sleep face down like this, right?
Hang on.
But then I need like I have a blanket for this. I don't know.
Somebody go get her blanket.
And
Get a towel.
then
So just show us the exact
I need
position.
the towel. And then this is a blanket. And then so like I'm like this and then the blanket and then I breathe this way.
Risking her life every night. She
Here,
gets to
and
sleep.
then I breathe, you know?
What is the point of the pillow then? What's
Doctor
No, I
doesn't
don't
think
really
about
use
that.
the pillow. So I don't look weird when people come to my house.
So she should stop that, right?
Nicole,
I'm not demoing anymore.
if you want to
bro.
sleep, if you want to sleep prone, here's what I
I
want
got
you
a
to
new
do.
pillow. I got
Here's
a
what I want you to do.
yeah.
Lie on your right side.
It does.
So you're on the
I
right
sent her a
side.
link together.
Oopsie daisy.
She sleeps on the massage table.
So slide to the edge here, because your bed is not this narrow, right?
No.
Slide back on the bed a little bit. There you go.
Scotty's up.
So then you can line up pillows here
I'm not gonna do
and
that.
there, and then you can sleep,
Go on, Nicole.
right?
Adhere.
This sucks.
I've never seen
So she keeps 3/4, and then she can have a pillow here.
I sleep at a 4.
So she can have a pillow down there, pillow there, pillow there.
What do we
right?
do? Like, this is like re-educating the patient.
Yes.
We have to
Yes.
re-educate her because
Yes.
this is a proper way to
It's
sleep.
contributing to the pressure on her jaw all night long.
All night
So,
long, Nicole.
but the person's gonna be like, I don't want to sleep like this because it's uncomfortable.
You can't force
You did
it to
your
do
job.
anything.
You did your job at that
Yeah,
point.
you educate.
I got a new pillow.
Perfect response, Dr.
No.
Patient refuses
So-
to sleep. Patient is super stubborn.
So right now, as she's healing, these are the positions I would like you to sleep in if you can. I understand that it might disrupt your sleeping pattern, but you're only feeding into the problem when we put pressure on there. If she's like that with her blanket on her, how much relaxation is she getting all night? With the pillow, with the thing pushing here, whatever. Because subconsciously it's like, oh, the blanket has to stay there in order for me to breathe. So I'm not really gonna sleep because my head has to stay there because I gotta breathe. That's the subconscious brain. So she's really not resting
Unless you're sleeping.
when she's sleeping.
That's why
Are
she
you?
falls
Bro, I
asleep in the
don't
library.
sleep. You know I wake up
blames it
every
on
hour
her
on the
cat.
hour.
On the long you did.
I wonder why.
Okay.
Because my cat is.
So
Yeah,
can
sure,
you
put it on the
can you
cat.
sleep on your side? Have you ever tried that?
Well, I got a new pillow, so I've been sleeping face up.
Okay.
It's like one of the cervical pillows.
Yeah,
that has
so
like
it
a
puts
dent.
my head in a hole.
Okay. Is it okay? So is it in a good position?
Yeah, it feels like that.
Okay. So if it's just resting like this, pillows off your shoulders, and this is your position for sleeping. Okay. So 90% of your job with patients with TMJ is getting them out of awkward postures and avoiding habitual patterns. Chewing gum, chewing ice, and any awkward holding the phone and talking.
Don't worry, John. You
Bad,
like to FaceTime.
bad, right?
Cuban women must
Okay.
have terrible TMJ.
All right, so back to exercise. Nicole, your homework is resting position of the jaw. So your lips are together, your teeth are slightly separated, and your tongue is on the roof of your mouth behind your top teeth. Got
All the
it?
time?
All the time,
Okay.
except when you're talking,
Okay.
which is all the time. No.
I'm not demoing anymore, guys.
You can tell. That's why we're like that. Okay? Your second exercise is your tongue behind your top teeth on the roof of your mouth, and you're gonna do slow controlled opening. okay? And I want you to avoid that disruption at the end.
Okay. Even though my tongue can stay there? Okay.
Because your tongue can't stay there like this, your tongue is staying there like this, and it's fluttering.
Okay.
Okay, so you want it as a point right behind your top teeth on the roof of your mouth. There you go. And close. Nice and slow. It's not a race. Okay. Open. Close.
It's
Do
so
we have any
hard.
TheraTube back there? Can you cut a chunk with those one pair of scissors we have for the entire institution?
Nah, Miss Linda has a few.
Dude, you're trying to get me fired? So, we're gonna put this between your teeth, okay? And then what you're gonna do is you're going to hold this between your teeth, and then you're gonna try and move your jaw to the right and then back to center. Okay? So you're just gonna, don't bite on it. Just keep it between your teeth and roll. There we go. That, okay.
What?
Let's settle down. Okay. Let's do it slow and controlled. See how abrupt her motions are? Because that's the only way she can move, because she doesn't have control. So that's movement coordination impairment big time. It's all or nothing. She can't slowly get
Don't at me.
control. Wow.
Just reinvent the wheel.
Okay. So just slightly between your teeth, and you're just gonna roll your teeth over. There you go. And then back to the center.
That's the snorkel she sleeps with.
Oh, just to the one side. One side.
She sleeps with a straw that goes through her.
Now, what's the benefit of doing it with the rubber?
So she's getting a little feedback between her teeth, and we're getting a little more control through the joint and the muscles, versus not having this and doing that. So we're controlling the motion. So it's just like proprioception. She's rolling between the tube. Okay, now try to left. Okay, can you come bite the tube a little bit? Okay, and come back to center. There you go. Come back to center. Beautiful. And come back to center. You're biting this? No.
Getting tired.
She's
I'm tired out
already,
here.
Right? So she's already got neuromuscular fatigue just from those few reps, right? So her homework is going to be resting position of the jaw, lips together, teeth slightly separated, tongue on the roof of her mouth behind her top teeth, okay? Part 2, she's going to do controlled mouth opening. She's going to do it 6 times a day, okay? 6 repetitions, 6 times a day, okay?
Got it.
Got it?
Got it.
Okay.
Can I keep the tube or?
Yeah.
Hell yeah. Don't
You already bit it, yeah.
don't be
Your
jealous.
saliva's on it. No. So sit up over the edge of the table. Okay. Get in a nice posture position. Okay. So what other things do you think are important for TMJ? For instruction? Postural instruction, okay. So if you're gonna teach people to sit upright or do retraction, then they have to have enough length in their pecs in order to do it. Okay, so that we might work on some pec lengthening, scalenes, diaphragmatic breathing, okay, because the scalenes are also a muscle respiration, so we want to get the scalenes to calm down, we have to get the diaphragm to do its job, okay? So Nicole, looking straight forward, okay, put your head in a center position.
Is it not?
Yeah. Okay, she's
I don't know.
tilted up a little bit, okay, so tilt the nose down a little bit, there you go, perfect. Okay, so she might benefit from what retraining?
Laser.
Remember the laser? The upper cervical proprioceptive retraining, because that's going to
Me
be
too.
closely tied to her movement coordination impairment of her jaw. Okay, so that could be something we start with as well. Because she wasn't sure where her head neutral position is. Where's her head neutral? Tip your nose down just a hit, not too much, right there. Does it feel neutral?
Nope.
Okay. Teeth slightly separated. Where's your tongue?
It's at the roof of my mouth.
Now it is. With your tongue up on the roof of your mouth, behind your top teeth, just do some gentle mouth opening.
Her head moves when she tries to open her mouth.
It's hard, isn't it?
Alan, stop making eye contact with me, bro.
He's like, you're doing fine.
He was
They're
matching
fake.
me.
So Nicole, when you're at home, if you can, this is best done in front of the mirror so you can see what's happening with your jaw.
You can see the difference.
It's harder in this position than supine, isn't it?
Yeah.
So she's really struggling with this, so I would probably just have her do it supine until she gets better at it.
Yeah, until it gets
But you see
stronger.
her neck, she's kind of like, okay, this is very uncomfortable for my head too.
That makes sense.
Right, so we'd have to do OA assessment, AAA assessment, see what's going on in the cervical
You're all
spine to get
rested.
her back in her position.
It's yours now, Nicole. Keep that.
Thanks, Sean.
Okay, so go ahead and open your mouth.
Where's your tongue?
Say,
You got it.
Alvin.
Okay, so Nicole, the other thing you want to be mindful of is you are not going to open your mouth more than 2 knuckle width. So put two your knuckles in your mouth, that is it. That's your mouth opening. So if you eat a hamburger, you need to cut it up or
Don't make
squish
it,
it
bro.
and
No,
eat
I'm
it.
not
Yes,
cutting it up.
squish
Cut
it
it
down.
up.
Just squish it down. Just while you're
I'll
healing.
squish it.
Compress your bacon.
I'll squish
While
it.
you're healing.
Compress your bacon. Cut it up for you. Compress your
Aw.
So
that
if
was
she doesn't
beautiful, John.
change,
No, eat it for you too.
No
so if
rush.
she doesn't change what she's doing, this is going to become a chronic issue.
Yes.
And it's gonna start going to her neck, and then her upper back, and then maybe her shoulder, things. So she's
Scare
gotta
tactics.
really, she's gotta do a few weeks of sticking to the plan, and then moving forward.
6x6.
Don't ruin the game.
So in Dutton is the Rockabato 9x6x6. It's 9 exercises. You're supposed to do 6 times a day, 6 repetitions each. The average person is not going to do exercises 9 times a day, so you gotta really pick the exercises based on dysfunction. But the first 2 are your most important. Resting position of the jaw and controlled mouth opening.
We'll make sure she does it every hour.
I'm sure you will. And you'll be sitting on the other side of the room next week.
Yes, I will.
Good?
Yep.
Does it make sense?
Yes, sir.
Okay.
That was pretty cool.
So get with each other and instruct people in trigger point release. You all had masseter trigger points, I saw it. So do your pressure release of the trigger point and then teach resting position of jaw and controlled mouth opening.
Got it.
Okay?
Great.